All right, awesome. Well, thank you everyone so much for coming on here. Before we get started, this is Ellie. She's the co-founder of Dilato with me. She's built this program that we're so excited to dive into later on. But first, we'd love to introduce Dr. Jessica. Jessica, feel free to unmute yourself, introduce yourself. Ellie will be controlling the slides, so just let her know when you want her to go to the next one, and then we'll get started.
Okay, awesome. So I will introduce myself. I am Dr. Jessica. I'm a naturopathic doctor in Toronto. You can go to the next slide. I believe there's an intro slide. And I am a naturopathic doctor in Toronto. I focus my practice on reproductive health, specifically for anyone assigned female at birth. And so, talking a lot around period health, pelvic pain, sexual and vaginal health is kind of my cup of tea, and really all I'm seeing in practice. I'm also a sexual health educator, so I've been in this space for quite some time. I think it is an area of health that is very much underserved, and oftentimes we are dismissed in our sexual health concerns. And that really goes a long way in terms of general reproductive health as well. So it's really an area that I'm so excited to be here in terms of educating all of you, answering your questions, and being of support in any way that I can. You can go to the next slide. Okay, so just to get into causes of pelvic pain, I'm not going to go too into any of this. It's just to kind of list out how many different things can be causing pelvic pain. So it can go from gynecological concerns, things like adenomyosis, ovarian cysts, to infections, all the way to things like non-gynecological concerns, things like irritable bowel syndrome. So our gut and our digestion is so interconnected with our reproductive tract that it's really important that that's being assessed as well. Obviously, any urinary or bladder issues, and then musculoskeletal causes. So, of course, the pelvic floor ties into virtually every condition that I speak about when it comes to pelvic pain. So, that's always going to be there. Herniated discs, things like chronic pelvic pain syndrome, and then nerve issues as well. Now, the stress and trauma part is an important part because we do hold a lot of stress and trauma within the pelvic region. A lot of times when we go to our doctors, they can sometimes say, oh, you just need to be less stressed, or just drink a glass of wine. Those are things that I actually have heard from my patients being told when it comes to pain with sex. And this is not to minimize that. It is just to highlight the very important aspect that stress and trauma really ties in really closely to the pelvic pain aspect of this concerns. And the next slide for me. Thank you. So I'm actually curious for all of you on the call, who knows what naturopathic medicine is? If you want to throw in anything that you are aware of, if you've seen a naturopathic doctor before, if you have questions or anything around naturopathic medicine, just throw it out in the chat. I'm going to kind of run through what naturopathic medicine is, and just kind of the difference between naturopathic medicine and some of the other things you might see available from a healthcare provider perspective. So, first of all, naturopathic doctors are regulated in certain provinces and states, and this means that we are held to a specific standard of at least 4 years of schooling at a specific accredited college or university. And then we're also having to do examinations and keep up with continuing education. Now, the reason I bring this up is because there is a term naturopath, which is not a regulated term and really can be something that someone can do a quick weekend course on herbs and be able to call them a naturopath. So it's really important that you're looking into the providers that you have just to make sure that you are getting proper, accurate care. Naturopathic medicine is a type of healthcare system where we really focus on the root cause of our patients' concerns. So we're not just treating symptoms, although symptom treatment is a really big part. We're actually looking at the why. Why are you experiencing the pelvic pain, which is where those causes come in? Why are you having endometriosis? Why are you having recurrent urinary tract infections? The why is what we are going to be assessing and treating through our appointments. So in the first phase of most naturopathic appointments, you'll go through a pretty in-depth appointment, which is up to like even 2 hours, where we're digging into your symptoms, your history, your lifestyle habits, health goals, all of those pieces. And then you're going home with usually, depending on the practitioner, but my approach is a foundational plan where you go home with some pretty in-depth testing. The testing is going to lay the foundation onto ruling out anything that could be going on, as well as assessing for the root cause of why you're experiencing some of your symptoms, which we'll talk about as well. As we move into the next phases of care, it's really just looking at optimizing treatment. What's really important is individualized medicine with naturopathic medicine. You can have 10 people coming in. There is 11 of us on this call. We can have 11 of us who are experiencing pelvic pain, and everyone is going to go home with a slightly different plan. And the reason being is because we're all unique. We have unique symptoms. We have unique clinical history. We're going to have unique blood work, and we're going to have unique reasons of why our symptoms are occurring. So that is a really important piece of what I do. And so you'll see in the strategy monitoring calls where we're checking in on symptoms, we're checking in on treatment, and making sure that things are actually moving the needle forward. When it comes to some myths around naturopathic medicine, there is actually lots of evidence in the research to support what we do in terms of supplementation, acupuncture, herbal medicine, nutrition for sure, and lifestyle approaches. So we take those all in consideration when we're doing treatment plans. So we can hit the next slide. So to start with lifestyle, I would say should be the foundation of any type of care that you're getting from a holistic healthcare practitioner. A lot of these things are things that you don't need to necessarily spend money on and have the most profound effects. However, lifestyle and nutrition oftentimes are the most challenging to start to implement. So starting with some basic things like sleep. When we think of pelvic pain, we don't always make that connection of how sleep might be impacting our pelvic pain. But when it comes to sleep, we do have very clear links on sleep being deprivation with sleep or irregular sleep, those types of things that can actually then lead to things like inflammation and insulin resistance, which is a root cause of some of the conditions that I talked about in the first part. So you can see how all of this ties together. If we're not sleeping well, our immune system is having challenges. We then can deal with recurrent infections, whether vaginal or UTIs, that can then cause pelvic inflammation. So this is where we're digging a little bit deeper, not just looking so surface level and trying to figure out how we can avoid things long term. Treating symptoms is one thing, but then how are we going to create sustainable changes long term and make sure that you're actually able to move through that in a way that is long term and sustainable versus just in the now and symptomatic. The next part is just at least 7 hours of sleep. So something to keep in mind there, the slides are changing. I'm not sure. It's okay. Just the previous slide. Perfect. Thank you. So with the recommendation of the number of hours we need in sleep, when we look at the 7 to 8 hours, just as a quick fun fact, it's not really fun, it's really sad, but when it comes to medical research, it was only including people assigned female at birth in like the 90s, which means we are really delayed in terms of what would be effective, what things are recommended, because they were typically done on male bodies. So when it comes to 7 hours of sleep, that was typically done in those assigned male at birth. And so when we actually get more research, we're seeing that it's much higher than 7 hours. So yes, at a bare minimum, 7 hours, but you might be needing closer to that 8.5 to 9 hours of sleep to really have restorative sleep. And so that's something to keep in mind there. Now, with stress, what we know is based on some of the most up-to-date research is that stress, not just now, but stress in our earlier life can definitely impact chronic pelvic pain. And so, as I mentioned, from a physiological perspective, yes, we hold a lot of stress in our pelvic floor. I always talk to patients about that idea that, yes, we always talk about holding tension in our neck and our shoulders and our jaw, but we're actually oftentimes holding some tension in our pelvic floor when we are stressed or anxious or we're nervous about something. There could be that tension. So really working on trying to release that can be really helpful. But then also from a more energetic or a mental emotional perspective, there's a lot of trauma that can be held in the pelvic region. And so all of that in combination, stress, mindfulness, those types of things, therapy can all be tied in here. Yoga being, yes, again, from a relaxation stress perspective, but we think of the very complex interplay of ligaments, tendons, bones, muscles that are all within the pelvic region can really help to open that up and really help to improve pelvic pain. The last part here is movement. Now, movement can really depend on the level of pelvic pain that you are experiencing. So I have some pretty severely advanced endometriosis patients where even a walk down the street can be pretty taxing because there's like bleeding involved, like heavy bleeding. There is also really chronic pain that they're experiencing throughout the month. So really it has to be based off of your capacity. When we're looking at the basic level of things, we want to get at least 30 minutes of movement in per day. When we're thinking about, again, those root causes, the inflammation, the insulin resistance, and metabolic issues that can be at the root of some of the symptoms that you're experiencing. So that's kind of a basic. Whenever I'm talking to people who are assigned female at birth, I'm always talking about menopause and really that strength training being a really key factor here and cardio. So one myth that you might be hearing a lot on social media is that we shouldn't be doing higher intensity exercises, and that is actually not true. We can't blanket statement anything nowadays. Unfortunately, socials allow these like very blanket statements to be kind of widespread. But when we look at the research, it is really important for higher intensity training to be done to improve cardio, metabolic health, insulin resistance, and those pieces that could be there, but always keeping in mind your capacity and what's feeling good in your body. So if you're doing something higher intensity and you feel really depleted after, that could be your body telling you, okay, maybe we need to slow it down, do maybe lower intensity, some walking, doing even some slower strength training, those types of things. Really listening to your body. Movement, any movement is better than no movement. There's also been even showing like 4 minutes of exercise can actually reduce your risk of cancer. So it's like any movement is better than nothing, just being really mindful of where you are at. We can switch slides. So when it comes to nutrition, again, an area where people are like, how does this tie into my pelvic pain? But again, when we're tying in kind of the type of medicine that I'm using, which is really about that root cause, if inflammation and immune health is going to be something that we're seeing, whether that is endo, recurrent infections, those types of things, then we are looking at something like an anti-inflammatory diet potentially. So looking at increasing your whole grains, colorful fruits and veggies, really lean proteins and healthy fats. Those are some principles of the many principles of the anti-inflammatory diet that can be really helpful for pelvic inflammation. It could also be helpful if we're looking at the gut and things like that that can really tie in there as well. I'm just looking at the questions. Okay, I will answer the question in a second. So the autoimmune protocol diet is something that has been used in a lot of patients who have any sort of immune related condition. So I keep bringing up endo because it is really common and it is something that is not readily diagnosed. It takes about 5 to 10 years to get a diagnosis for endometriosis, which is really sad. And so for me, whenever someone comes in with severe pelvic pain or severe menstrual cramps, I'm pretty much treating endo until proven otherwise, until we're able to get the tests. And so with the autoimmune protocol diet or the anti-inflammatory diet, those are just some things that we can look into just to make sure that the patient is still doing things to reduce any type of pelvic inflammation. Now, something I should have said at the start of this presentation is none of this is medical advice. You'll see that I keep saying it's very individualized, and that is the whole thing. It is very individualized. You do need to talk to someone to get some more specifics when it comes to dosing, types of diet, if you need to remove triggering foods, those types of things. So just keep that in mind. The other piece here is increasing polyphenols. So really eating the color of the rainbow. Make sure your plate is colorful. So it's not just about the veggies and fruits, it's also herbs, seeds, nuts, and spices, things like that. That can all really diversify the types of nutrients that you are consuming. Polyphenols has been shown to improve insulin signaling. It is powerful antioxidants. It can help to prevent issues with chronic diseases, whether that be cancer or diabetes, those types of things. And then when we tie it into pelvic pain, endometriosis, adenomyosis, ovarian cysts, all have things that tie into some of these antioxidants. So things like resveratrol, we've heard a lot of that. And we'll talk about that in the supplement part, but that is a really powerful polyphenol that is actually found in foods. So we can get a lot of these nutrients, a lot of these really powerful supplements actually through diet. It's just not necessarily in the dose that has been researched, but still can have really beneficial effects. When it comes to food triggers, when people get nervous about seeing NDs, their first thing is like, do I have to cut out everything, like dairy and gluten and sugar and all of the things? I'm a very, I try not to be super restrictive with my patients, and it's really on a case-by-case basis. So some people do really well removing dairy and gluten because it can be inflammatory for some folks. It really depends on the person, but that's something to keep in mind that food triggers can be something we are investigating. That kind of ties into the gut health piece. So really tying in gut health and our pelvic health, reproductive health, vaginal health, those connections are super strong. Our gut is just everything. It's like the foundation of virtually every condition. It ties into our immune system, our brain, our mood, our stress. And then when it comes to our hormones, it ties in. And then it's so close to our reproductive health, our reproductive tract that they have a crosstalk. So when we have issues with our gut, we often have issues in the vagina and in the uterus, and they're all very interconnected. So the elimination diet, low FODMAP can be talked about there, as well as obviously supplementation, which we'll talk about in a second. Insulin resistance, I've maybe mentioned around 15 times already. And that's because it is something that we are seeing time and time again come up in practice, being something that is furthering issues with pelvic inflammation, period pain, the whole yard. So when it comes to insulin resistance, we're looking at choosing more complex carbohydrates. So that would be choosing things like sweet potato over white potato, choosing things like whole grains, quinoa, and things like that over refined white processed grains. So those are things to keep in mind there. Reducing insulin stimulating foods, so high sugar, processed carbohydrates, those types of foods. Increasing fiber, fats, and proteins. I like to just pause here because I feel like oftentimes we are going out for dinner and there could be guilt around food. What I try to suggest is if you are going out, let's say a pasta, for example, some ways that you can optimize that meal without having to stop eating your favorite foods is just ensuring that you are having fiber, fats, and proteins at your meal. So things like at that pasta, maybe you're having a protein in the pasta, maybe you're starting with a salad and adding some olive oil. That will hit the fiber, that will hit the fats, and then the protein within the pasta. So you don't need to necessarily cut out a lot of things. It's actually about adding in and optimizing our plates. And then the optimized meal timing. So sometimes I'm encouraging snacking between meals for some people if their blood sugar goes really low, if they're high stress. And then for other people, I am recommending we do not snack for people who have really high insulin. So again, really with that meal timing is dependent on the person. And then some other things, hydration. I know it's talked about and you're like, oh yeah, okay, I have to drink 2 liters of water. But when we think about vaginal mucosa, it's very, very moist. There's a lot of moisture in that area. And it's really important when we think of any sort of pain with vaginismus, when we think about pain with insertion, and then when we think about producing lubrication, hydration is something that needs to be there. So even with some of my fertility patients, when they're finding that they're not producing a lot of cervical mucus, we actually up hydration and we can see that play a role. So that's just something simple that we can do. And then nutrient-specific foods. So magnesium, B6, omegas, we can get that all through our diet. So again, just really diversifying our plates and ensuring that some of those macro and micronutrients are present. I'm going to take a look at the chat real quick. So can diet affect pelvic pain? Yes, because not necessarily that what you eat is going to cause pelvic pain, but what you eat and how you eat it and the timing and all of that can cause things like inflammation, which then can worsen the pelvic pain or cause the pelvic pain. So it's kind of this pathway to that, which is why it's not the only thing we're doing with treatment, but it's a really, really, really big part. Difference between going to a gyno versus a naturopathic doctor. So a gynecologist, first of all, I am working in conjunction with a lot of healthcare providers, like definitely pelvic physiotherapists, 100% are very present in my practice. Sex therapists for sure, and gynecologists, OBGYNs, fertility clinics. It is not a one or another. It's really using both, and that's how we can shift the healthcare system is if we start optimizing how to use both in these types of scenarios. So a gynecologist is going to be able to really assess things in a different way to me. My scope of practice in Ontario is quite limited, unfortunately, but in other states and provinces, I would be able to prescribe certain medications, insert IUDs, do transvaginal ultrasounds, like do the whole yard. So it really depends on where the naturopathic doctor is located and what their capacities are. Here in Ontario, I'm not sure if many of you are in Ontario, but here there are big differences between what I can do and what a gyno can do. So they can really help with some of the medications that might be necessary, really doing some of those treatments that are really, really effective. And we see that in the research time and time again when it comes to pelvic floor issues or pelvic pain. So that's their side of things. They're able to do some of those assessments and refer you to imaging and testing. For me, I come in and I'm able to support, again, the root of the issue. Gynecologists are not trained in nutrition. Maybe they have like a 1 day course, but it's very limited. And they're not able to do supplements because there's no training in that. They have to focus their time on the prescriptions, and really assessing and diagnosis in terms of that. So that's their jam. When we're looking at chronic issues, that's more of my jam. So that's where I'm really digging a little bit deeper. You have so much more time with me. So it's not just about what are your symptoms in 15 minutes. I can take up to an hour and a half with you so that we can really dig a little bit deeper and uncover the layers like an onion to really figure out what's happening beneath the surface. So I hope that answers your question, but definitely let me know if there's any further follow-up there. Da, da, da. Okay. So how can I start to release that pelvic floor tension when I automatically activate it through the day and I don't even notice? I do it a lot and want to be more aware, but I don't know where to start. I feel like that's more of a question for the pelvic physiotherapist. So if you want it, one of you want to answer that one.
Could you read the question out one more time?
Yes. How can I start to release the pelvic floor tension when I automatically activate it throughout the day and I don't even notice? I do it a lot and want to be aware more, but I don't know where to start.
Yeah. So hi, I'm a public physiotherapist. I've been practicing for about 8 years. I get this question a lot with my clients. I would say one thing you can do right away is just diaphragmatic breathing. So you can put one hand on your side rib cage, one hand on your belly. Inhale, open your lower belly and side rib cage as if you're almost opening an umbrella or a flower down there for 4 seconds, and then exhale out of the mouth for 6 seconds. So some key things here is on the inhale, you're visualizing the pelvic floor muscles or the muscles down there opening almost like a flower. And then your exhale is kept nice and long because that's supposed to calm down your nervous system. This is a way to not only calm down that automatic kind of tensioning in the pelvic floor, but also is a great way to release your pelvic floor. That's one component that can help address some of the physical as well as kind of like mental holding patterns. Another thing is kind of addressing maybe sometimes like the stressors, both internal and external in your life. So if you notice, for instance, like before a meeting, you're like tensing up your pelvic floor, or when you get on a phone call with your mom, or I don't know, there's stressors in your life that you're noticing the pelvic floor is tensing up. You can use many different strategies like the breathing one, or I do a tension offloading strategy that I'll teach clients where you just squeeze your thumbnail to your index finger. So it offloads the tension out of your pelvic floor into somewhere else. That's why there's a lot of yoga poses where they're kind of like, doing this because it offloads tension elsewhere to your body. So you're not tensioning your pelvic floor. But those are some quick ways. So the 4-6 diaphragmatic breathing with visualization, opening the pelvic floor, and then the tension offloading strategy are some great ways that you can incorporate in your day to help relax the pelvic floor.
That's awesome. I like that one. I've never heard that one. So that's
Yeah, yeah. A lot of my clients that have like urgency or like pelvic floor tension issues because of tightness are like, really, this works? And then they go home and they're like, actually, it
it
works.
works.
And they're like shocked because they're like, it's the simplest strategy. And they're like, I can't believe it worked. So try it. Sometimes it's the most simple things that can be the most effective.
Amazing. Thank you. I keep seeing trendy vaginal health smoothies on TikTok. Do these hold any credibility? Is there something I can actually drink that helps the pelvic discomfort? That is such a good question. Um, there are so many trends on TikTok. If I could debunk a lot of them, I would if I had the time. When it comes to vaginal health smoothies, or anything where it's saying this is a smoothie that you should drink every day to cure your endometriosis or cure your pelvic pain. That is just not this very simplified way. And it's in a way, it really does a disservice to people dealing with pelvic pain and dealing with some of these complex issues because it minimizes it to just drinking a smoothie and my problems will be solved. So when it comes to vaginal health, there's obviously things in the diet that will be helpful. So we look at things like antioxidants, we look at an anti-inflammatory diet, we look at increasing polyphenols. We also look at getting certain nutrients from our diet. So there is research on coconut oil being anti-candida. We look at apple cider vinegar also being in there that can be helpful. Reducing sugars can be helpful for some folks. So yeah, there's definitely dietary things that can help. But when it comes to a smoothie, if it's just going to be like adding berries and adding really like colorful fruits and veggies, having some protein, really that's going to be something that will be good for everybody. It's just some of these extra things like coconut oil, apple cider vinegar, and some of those things in the research could help, but it's not going to be something that is going to really shift the needle. in a dramatic way. I hope that that helps. There's not really a drink that's going to improve things like right off the bat. Things that could help might be some warming anti-inflammatory teas. Things like ginger can be really soothing. Anything that's going to include any sort of anti-inflammatory herb. So even like turmeric, cinnamon, those like warming herbs that can be really helpful. Raspberry tea, red raspberry tea also can be really good. So there's different things like that that can be helpful from a drink perspective, but it's not necessarily an easy fix or a quick fix when it comes to drinks and pelvic discomfort. I think, okay, another question for Ellie, if you want to answer that now or you want to wait. Okay, so it says, can you comment on the use of dilators?
Yes. So, I mean, dilators is one tool that you can use to help relax or release the pelvic floor muscles down there. But again, it's not a stand alone use tool, right? So it's a way to dilate and visually see how you're able to release your pelvic floor. But pelvic floor tension we just talked about is so holistic in nature, right? It could be like caused by things like diet, it can be caused by things like sleep, it can be caused by things like biopsychosocial, which is like kind of what we call the fear, tension, pain cycle. So your fear of insertion can create tension, which can create pain. And a lot of the time, not addressing all these things and just using a dilator typically is not going to lead to that long-term improvement with painful sex that you're looking for. That's kind of why me and my co-founder Asia created Dilato, because we're like, oh, like we are coaching people maybe in one aspect, but we're like, but you need this like really holistic approach, right? Like you need to understand like the naturopath and like, you know, what are the food and supplements? You need to understand like from a psychotherapist perspective, how is like fear with insertion playing into your pain? And then dilator is one tool, but you also need to understand how to use a dilator, how to address some of the fears that come with using a dilator, right? And then also have confidence on how to use a dilator properly. But when used properly, it can be a really awesome tool, especially I find if you're a visual person and you can really see like how you go up a dilator size from small to large. And then if you get to the largest size, that's when you could attempt to try penetrative sex and see if it like hurts or if there's reduction in pain, because you're able to visually track your progress. And that's what I think is the beauty of using a dilator. Hope that answers your question.
Awesome, thank you. Okay, so before we get into supplements, this is like the most exciting part. Everyone's so excited about figuring out what supplements I should be taking. Like I mentioned, this is a medical device. Supplements, yes, they are natural, but natural does not equal safe. And so I would really caution all of you on the call today to be mindful of the accounts that might be telling you what you should be taking for pelvic pain. And the reason I say that is I see so many patients coming in on a plethora of supplements, like 15 different supplements that they're on because they read an article or they heard it or whatever. Now, the thing with supplements is there's three things that are really important. The quality matters. So, for example, if you're getting supplements from a local health food store versus Costco, you will notice a significant difference in the quality. That is why you can get supplements in bulk at a Costco or a Walmart. But when we look at Health Canada has actually revoked or recalled a lot of supplements that are typically found at those shoppers or Walmart or Costco areas because they've either not disclosed all the ingredients or the doses that they've reported on the bottle are actually not what you're consuming. So quality over quantity is absolutely fundamental, especially when we look at certain things like omegas, like that's derived from a fish. And when we think of heavy metals, if you're not getting a high quality supplement, you could be exposing yourself to things that could actually worsen your pelvic pain. So those are things to keep in mind there. The other thing is that the dose matters. So you might see some influencers who have created proprietary blend supplements that don't list the amount of each herb or nutrient in it, but just have a list of a bunch of different ingredients. The problem with that is we have absolutely no idea how much of each ingredient is actually in that supplement. When we know based on certain research articles and medical research, we know specific doses matter. The timing of the dose, if you're having it with food, without food, the amount of milligrams of that supplement or herb that's in that product matters in order for it to be effective. So if we're thinking about spending money on supplements, quality for sure, making sure they have listed the dose in terms of what is included, and then ensuring that you're getting advice from someone who's actually trained in supplementation. And the reason I say that is there's very few of us, functional medical doctors, naturopathic doctors, we have over 4 years, holistic nutritionists also have some training as well. Most dietitians do not. They're more focused on nutrition, and in schooling, they typically aren't diving too deep into supplements. Medical doctors do not. And so health coaches, influencers sometimes do, sometimes don't. So really looking into who you're getting this type of content from is really important. Now that I'm done all of those disclaimers, let's jump into it. So you can see that I've described, or I've kind of broken it down into those 4 typical root causes when it comes to pelvic pain. So if we start at the top with inflammation and immune system, we're looking at things. So food-based supplements can be really helpful. So things like ginger, turmeric, and omegas. Those all have really great research when it comes to reducing pelvic pain. So starting with ginger, I'm going to just do something really quick here. Ginger has been shown with between 1,000 and 1,500 milligrams of ginger has been shown to help to reduce period cramping significantly. Like it has been associated with an improvement in pain as well or better than NSAIDs or painkillers. So there's really good research when it comes to that, but it needs to be dosed a specific time of your cycle and for a specific amount of days. So that's just one of the examples. Omegas also have really great research when it comes to inflammatory conditions and reducing menstrual pain as well. So that's kind of tied in there. Proteolytic enzymes are things that can break down protein. And so when we think of endometriosis, for an example, or any condition where there is a growth, so even ovarian cysts, fibroids, endo, where there's a growth, typically these are some of those enzymes that can break down those formations. So whether it's bromelain or papain, those different types of enzymes that can actually help to break down some of that excess material within the pelvic cavity. Antioxidants and nutrients are also going to be there. Things like quercetin, resveratrol is up there as well, all of which can help with inflammation and immune response. The immune system, when we think of nutrient deficiencies, we're looking at your vitamin D, we're looking at your B12, we're looking at your thyroid and making sure that those are optimized so that we can help to support the inflammation and immune system piece of it. Now, immune supportive herbs can be anywhere from antiviral things like echinacea to specific things like reishi and things like that. Really just kind of a diverse level of things. Like I can list probably 30 herbs that can help support your immune system. Now, the way we choose it is really dependent on you. So are you someone that has a potential autoimmune condition? If that is the case, I'm not doing mushrooms, for an example. If there is someone who is prone to recurrent vaginal infections, I might be choosing certain herbs that specifically have they're tailored to the vaginal canal or vaginal tract. So those are just kind of things to keep in mind there in terms of immune health. Now, as we switch gears to nervous system and stress, nutrients are a big part here because our adrenal glands, which are really important, we think of, you might have heard adrenal fatigue or high cortisol and all of these things. Not everyone has high cortisol, even if you're really stressed. Although that hormone is produced, there is something called where it's burnout, basically, where your adrenals are so taxed, your cortisol is very low. That's where testing comes into play. And so really looking at what's going on with the adrenals can be really, really helpful. So from a nervous system and stress perspective, like we mentioned, there's such a tie with the way we're holding stress in our body and our pelvic pain. It also relates to the fact that the pelvic pain cycle is also really important here as well. So when we're experiencing such chronic pain, whether it's just with sex, just with our periods, or also outside of that and kind of a chronic pain that we're experiencing throughout the month, it can really be debilitating for our stress, for our mental health, especially. So we're looking at nutrients, yes. We're also looking at adaptogens. Those are things that help to support the adrenal glands. That's things like licorice. Reishi is also an adaptogen. We can also look at ginseng. Honestly, the list can go on. So again, how I'm choosing that is based on how you're appearing, what we're seeing on blood work, just to make sure that we're choosing something that is tailored to you and not going to be unsafe based off of the conditions, what we're seeing in blood work, and then of course, any medications that you're on as well. And that's like the biggest thing with herbs that I will say is medication interactions and condition interactions are more important when it comes to herbs over supplements like nutraceuticals, things like vitamin D, ginger, those types of things. Sleep support. really big. Like I mentioned, sleep is going to be foundational to improving our circadian rhythm, which is related to cortisol, which is then tied into pelvic pain. It's also really important when we're thinking about reducing inflammation, supporting our immune system, and supporting insulin resistance. So, sleep support, yes, we can use melatonin in certain instances. Melatonin has great research to support its use with endometriosis, actually, which is really cool. But it really depends on the person and what I'm seeing. So if you're having trouble falling asleep, that might be an instance where we might use some melatonin. If you are someone who maybe does shift work, that could be helpful. People who are trying to conceive, melatonin has multiple benefits there as well. But otherwise, we could be using herbs. Things like valerian, passion flower, all of those that can be kind of sedative or just get us into a bit more of a restful state. Nervines are things that support the nervous system, and they often have overlap with adaptogens and supportive herbs, and really just trying to calm the nervous system down. We are in typically a higher state of stress a lot of the times, just whether it's related to work, family complex, the world situations that are going on. Like it could be anything that could be causing chronic levels of stress within us, and those nervines and stress adaptogen supports can be really, really impactful. Now, from a hormone perspective, the way this ties in, I could probably talk for so much longer, but I'm going to just try to give like a really brief overview on the hormone piece. Typically, when we look at hormones, we often look at estrogen as the bad guy, but we need a good level of estrogen for things like our vaginal mucosa, for our ability to ovulate, for those types of things. Like we need good estrogen. We also need progesterone. And when those are out of whack, we could definitely see some issues with pelvic pain, especially when it comes to endometriosis, to painful periods there as well, to PMS, all of those things that are typically tied here. So estrogen metabolism is something that we can look at, but if you look at some of the herbs that they recommend for endometriosis, they'll sometimes always jump to estrogen support. As a fun fact, endometriosis is not a hormonal condition. It is an immune inflammatory condition that is influenced by hormones. And so that is something to keep in mind that it's not always something that everyone should be on. So things like DIM would fall under that category, as well as things that are found in cruciferous vegetables, those different things that they can pull out and extract are part of that estrogen metabolism. Insulin and blood sugar support. So insulin is a hormone. That's why I put that here. And it definitely is tied in, like I said, to all those conditions that we've talked about, whether vaginal infections, gut health issues, and the pelvic inflammatory conditions as well. And then that could be just when we talk about herbs, it could be berberine. It could be things like inositol and acetylcysteine, really ranges depending on the person. And then the liver support is there as well, just because it is really important to help to clear some hormones. Everything goes through our liver. If our liver is sluggish, then we're not going to be detoxifying some of those excess hormones, which can then lead to that pelvic inflammation that could be happening in your case. Progesterone support. Progesterone is like that calming hormone. It just like relaxes everything. So while estrogen is like building your uterine lining and helping us to shed blood, the progesterone is helping to thin that lining and help to prevent pelvic pain or heavy bleeding. So they need to be in that interaction. And so progesterone is something that we can support both supplemental, but also in certain provinces and states, I can actually prescribe progesterone, which we can do vaginal or oral just to help to support that as well. And then when we shift gears to gut health, depending on the case, we might be looking at gut motility if you're really constipated, if you have sluggish bowel movements, if you're not feeling like you're clearing your bowel movements with when you're having a bowel movement, like you're not feeling like it's fully released, that might be something we'll look at. Antimicrobials, if there's any signs of SIBO, bloating, even constipation or diarrhea, if we've had chronic UTIs, chronic vaginal infections, those types of things, we'll be looking there. Probiotics, not everyone needs a probiotic. But probiotics can be helpful, especially when we're seeing the increased use of antibiotics. People may be using antibiotics without actually having certain infections. All of those types of things, definitely probiotics should be on the list. Gut lining support. So when we think of things like leaky gut, I'm not sure if anyone knows what that is, but it's basically intestinal lining having holes. And so what happens is that it causes a lot of inflammation in the system because things are leaking out of your gut that should not be leaking out. It should be actually getting excreted, which can cause a lot of inflammation. And that's something that we can support. And there's lots of things. L-glutamine is just one of the examples, but there's so many things that we can do to help soothe the gut lining. Now, as you can see, I didn't list doses, I didn't list specific supplements. This is to give you inspiration of how much we can do when it comes to pelvic pain. When we go to our traditional medical doctors, we're maybe getting told to go to a pelvic physio. I would be floored if they said that, but I would love to be told to go to a pelvic physio. They might be telling you there's not much we can do. Maybe they do a couple of assessments. Maybe they tell you to go on the birth control pill, which is very useful in certain cases, but there's not a whole lot else. So this really hopefully can give you inspiration on how naturopathic medicine can fit into pelvic pain and all of the different approaches and options that we have to help soothe and treat your symptoms, not just from a symptomatic perspective, but from the root. We can go to the next slide. I have, I believe, 2 more slides. Acupuncture is another modality that I am trained in. So whether you go to a naturopathic doctor or an acupuncturist, there's really cool research on acupuncture. So things like shortening the duration of pain, lowering the intensity of pain, improving painful periods, improving well-being and quality of life, and also being more effective than some painkillers. So really thinking about that as an option. I know so many patients that have done really well with acupuncture, and it really just has to be something that is done consistently, but can be very, very, very powerful. So that's just another area where we can see another treatment option available to us. And then I wanted to kind of end off with sexual pain and desire because it is something that obviously comes up quite a bit when I'm dealing with pelvic pain and the patients that are experiencing any sort of vaginal pain as well. So a big part for me, like I mentioned, I collaborate with pelvic physiotherapists all the time and sex therapists really to treat the whole person, supporting lubrication production. So yes, hydration, but also hormonal support. So if estrogen is low, then we're going to see more vaginal dryness, for example. So whether we're supporting estrogen through diet and herbs and supplements, or we're doing a topical vaginal estrogen, there's different things that we can do there. There's also actually certain things that can be done within the diet or even suppositories that can help depending on what I'm seeing or what the symptoms are. And then treating vaginal infections as well. So we know that vaginal infections can actually be a stem or kind of the starting point in which pelvic inflammation starts. And so endometriosis has been linked to candida or overgrowth, for example, or like all those links can be shown. And so treating vaginal infections is a really, really big part there as well. Now, where desire fits into all of this, when I have patients coming in mentioning libido, their usual thing is, I didn't know that this was something that you would treat. And the thing with desire is it's so impacted by so many things like our energy, our self-esteem, our stress, things around pain. So that pain cycle, if we're constantly experiencing pelvic pain, our body will brace and be bracing for that pain, expect the pain, and we will start to avoid sex. We'll start to avoid medical procedures. We'll start to avoid those things because of the bracing or the anticipation of that pain. And so my purpose would, or my focus would be to treat the pain, but also treat all those other factors like energy and stress that could be furthering that sexual desire drop that you might be experiencing. So that's kind of just something that gets tied here. It honestly sounds really complex, but when we simplify it, we can see how our whole body is so interconnected. And so we need to really be assessing and treating all of those varying moving parts to really start to see some of these things optimized. I'm going to just throw into the chat, created just a free handout for you guys around pleasure mindset and just kind of moving through some of the different things that might be whether holding you back or just things that you need to work through. There is some options there to also chat with me and further if you want some other supports. But that is all for me.
Wow, thank you so much, Jessica. This is her Instagram, Dr. Jess ND, if you guys want to connect with her, and her website if you want to book in with her or find out more or connect with her. I also want to, oh, perfect. Yeah, and then want to talk a little bit about our program as well. I mentioned me and Asia have created a program called Dilato. So if you really like today's talk and you're looking for kind of more resources to help you in your journey to pelvic pain, we've launched this like app called Dilato. It's available on app as well as web platform, but it features bunch of videos from experts like myself and different sex coaches and psychotherapists to really help guide you on your journey and kind of give you guidance on also, there's a whole dilator gym section as well as we have a pelvic studio with guided meditations and yoga flows. So it's a really nice like plug and play and a journey to kind of guide you through the journey together. And also there's a community platform so you can connect with other people going through the journey to pain-free sex that you are. So yeah, it features myself and Asia, and then we have about 50 videos on there from multiple experts, as well as those guided practices and check-in points to just track your progress through the journey. And these are some reviews from some of our clients who have gone through the program, and we found that more than 80% of our users of our platform was able to progress in the insertion of whether it be a tampon or having sex for the first time within the first 7 weeks of using our program. And we have both like a yearly subscription and a monthly kind of subscription model as part of our program. And Asia should have put a little link on the chat. So if you want to sign up, there's also, you can look up our app on the App Store by just looking up Dilato Tech, or check us out also at dilatotech.com if you want to find out more. And that's it for me. So I'm Ellie, again, one of the pelvic floor physiotherapists, and I'm so honored to have Jessica here. I've learned so much, hope you guys have, about kind of the role of diet and sleep and supplements and acupuncture, and how a naturopath can also help with libido and desire. Perfect. Yeah, thanks everyone for attending. We really loved having everyone here, and like to thank you again, Jessica, for coming on and educating everyone on the naturopathic approach to pelvic pain. It was really informative. I know I learned a lot. Yeah, and please reach out to her if you have any more questions about naturopath and how I can help you with your pelvic pain.
Thank you so much for having me, and for all of you for being here. I hope you learned even one thing that can inspire you to realize that there's so much that we can do to help support you. So
Yes.
everyone have a great night.
Yes. I'm going to end up with this.
Yeah.
Okay, good night, everyone. Bye.